Hi folks, welcome to my channel, The Average Dermadoc. Let's begin the show. Robert Williams Wood is an American physicist. Why I am telling his name first instead of our topic name was, it is the minimum respect we have to give such great humans. What he did, he only invented this Wood's lamp in 1903. Till now it is being used. What is it? It is a simple, no need to have any extensive knowledge to use it. Simple, non-invasive. It won't do any harm to the patient. So we can do multiple times. We can also use it to assess the response of treatment. It is portable, means we can easily move from one place to another place. Used for diagnosis and differentiating various skin diseases based on the principle of fluorescence. Wood's lamp is a source of UV light that emits UVA radiation above 365 nanometer wavelength only. Why I wrote here the word only? Here if you observe, I wrote UV light, which means it can be anything A, B, C. Just I wrote vaguely UV light, but here specifically I wrote UVA radiation. This specificity is given just because of this filter, Wood's filter, named after him only, made up of barium silicate glass with 9% nickel oxide. It filters out all other light except UVA radiation above 365 nanometer only. Before using the instrument, we have to know how to use it. Some instructions. Warm up the device for a few minutes. Minimum 1 minute is enough, but anyhow we can warm it up for a few minutes. Then wipe away any topicals, soap residues on the lesion, but don't wash the area to be examined prior to examination, because the pigments which gives the fluorescence may be washed away. Examination should be done in a dark room. After dark adaptation of the doctor, holding Wood's lamp 4 to 5 inches away from the lesion. Don't wear white coat, white shirt. Anything white will distract our vision. Simple 4 instructions. 1. Warm up. 2. Wipe away any topicals. 3. Dark room, dark adaptation. 3 to 4 inches away from the lesion. 4. Avoid white coat, white shirts. Next, coming to uses. In pigmentary disorders, if the pigmentary variations is within the epidermis, then the fluorescence will be enhanced. Example, depigmented patches of Vitiligo vulgaris and ash leaf macules of tuberous sclerosis will become bright white after this UVA light falling on it. But whereas in dermal lesions like nevus anemicus, the fluorescence completely disappears. The lesion completely disappears. So in this way we can differentiate between epidermal lesion from dermal lesions. Next, tumors in photodynamic therapy. We will deal in detail when dealing with photodynamic therapy. Next, porphyrias. Porphyria cutanea tarda, urine and feces. Erythropoietic protoporphyria, blood. Congenital erythropoietic porphyria, teeth. In bacterial diseases like acne and erythrasma, all these will give a coral red color because of the pigment porphyrin, common pigment porphyrin, which gives coral red color. Next, another bacterial disease, Pseudomonas. We all everyone know because of the pigment pyocyanin, it gives green color. Next, fungal infections, Tinea capitis. If it is caused by Microsporum canis and adoni, it will give brilliant green color. If it is Trichophyton Sean-Lenni, it gives pale green color because of the pigment pteridine. Only these species will give fluorescence and can be diagnosed using Woods lamp. Rest all fungus won't produce any fluorescence, and Woods lamp is not useful for diagnosing. Next, fungal infection, Pityriasis versicolor because of pigment Pityria lactone or Pityria citrin. It will give yellow color. Drugs like tetracycline, mepacrine for nails, tetracycline for teeth will give yellow color. If we prescribe tetracycline for pregnant and children less than 8 years, it will go and form complexes and get deposited in teeth as well as bones. It will cause bone retardation, bone growth retardation, which is temporary, and after stoppage of drug, the growth of bones will resume. But the discoloration of teeth is permanent. With naked eye also, we can see that yellow color. It will be a lifelong trauma for children. Mepacrine is an acridine dye. It gives yellow color to nails. Both these to appreciate, we can see with naked eye only. Without Woods lamp also, we can appreciate the color. Those who suffer or those who had suffered only knows what a trauma is. So, prescribing a drug is important, but knowing what drug not to prescribe is even more important. Never prescribe tetracycline in pregnancy and in for children. To avoid teeth discoloration only. Chrome hydrosis. Apocrine sweat will give yellow color because of pigment lipofuscin. It can also be used for scabies burrow visualization and in suspected dermatitis artifacta. If he is voluntarily scratching or creating any lesion, his nails will have that fluorescent cream which we applied deliberately by to know purposefully he is doing or not. So we can examine the nails. Under the nails, the pigment which we used fluorescent cream will get deposited, and we can easily find out whether he is voluntarily doing any trauma to himself. Dermatitis artifacta. What are the advantages? Mass diagnosis of tinea capitis in contacts and schools to assess response to treatment. Hairs that fluoresce are selected for further testing like KOH or culture. Specifically, that hair can be selected. Pitfalls. Most fungi do not fluoresce. I already told you in tinea capitis, only whatever the species I wrote will fluoresce. Most other fungi will not fluoresce. So, a negative test does not exclude the diagnosis. Simple Woods lamp principle fluorescence. What are the colors? We will go color wise, it will be easy to remember. First, white, basic common sense, white for vitiligo, ash leaf macules. Next, red. The name red indicates erythro in scientific words. So, whatever the word starts with erythro, erythrasma, erythroporphyria, congenital erythroporphyria, erythrobiotic protoporphyria. Next, 2-piece photodynamic therapy, porphyria cutanea tarda. Extra only one thing you have to remember is acne. All these will give red color. Next, green. We everyone know Pseudomonas because of pigment pyocyanin. Tinea capitis, Microsporum and Trichophyton Sean-Lenni because of pigment pteridine. Next color, yellow. Tetracycline for teeth, mepacrine for nail, Pityriasis versicolor and chrome hydrosis. Don't forget to like, share and subscribe. Thank you. Hasta la vista. До свидания.